Today, there are thousands of cancer patients who are going without the care that they need. These Americans can't get health insurance because of a pre-existing condition, or they end up filing for bankruptcy because the insurance they have doesn't actually cover the cancer care that they need. These egregious insurance industry practices must end.
Ronald Reagan used to say that the status quo is Latin for the mess we're in. And I think nothing could be more appropriate than using status quo to describe the current health system. It's broken.
And you're going to hear a lot of people in the next few months talking out of one side of the mouth and then another. Oh yeah, we need to help patients with cancer, but we don't need to do anything about it. You better listen carefully to that, because the time for action is now.
It's time to choose a side. Which team are you on? Are you going to be on the team that's going to be about slowing things down and stopping things or putting up obstacles? Or are you going to be on the team to move forward on health care reform? We say today that it's time to move forward on health care reform this year.
Appreciate this opportunity to be a part of this groundswell opportunity for health reform. And we're here to kind of energize, to let you all know that the college coaches are here to do what we can to support this great cause and change this. But it's always, the time is always right to do the right thing.
If you have cancer, you don't have time to table this whole thing and start over and wait till next year. Because if you do that, then so many good people will be stricken with the disease. Because they can't get diagnosis. So many people will die because they don't have the proper care, and so many families, just like yours and mine, will be negatively affected.
Personally, I've been touched by cancer, and I think that's why my involvement with the Coaches versus Cancer is so special to me. Both my father, my mother, and personally myself 5 years ago went through a bout with bladder cancer. So I know firsthand what the disease can do to you. And I know how it can really hurt a family, obviously the cancer itself, but financially can hurt a family as well.
My father is a cancer survivor, has beaten a malignant melanoma in the early 90s, which energized me to try and find a cure for this dreaded disease. But I was an assistant at Duke University at the time and was able to get him into the Duke Cancer Center, and he got the best care. He's 80 years old. And he's coaching my team every day now, which is great. But everybody should have that access to the best and to a way of solving this.
Cancer's touched all of our lives in one way, shape, or form. In November of 2005, my wife was diagnosed with breast cancer. And relative to treatment, to her treatment, we were fortunate. We were fortunate because there was early detection. We were fortunate because we had sufficient health care. We were fortunate because what wasn't covered, we were able financially to take care of the bills. Unfortunately, our situation is not the norm. We have to make sure that the people that need treatment, that need help, get it. And that's where the health reform, we must have it. We must take action now, not later. And I'm excited. And it has to happen now, and we're going to continue to fight until it happens. Thank you.